Hello, thank you for joining us for our third ACHD webinar that we've done this year. I'm just going to wait a second to see if there's anyone else that is going to log on here. Perfect. Hopefully everybody has not lost power with the crazy weather we're having. And if this is your first webinar that you are joining us for, there is an area where you can send in questions in the chat. So if during the presentation there are any questions that you guys would have, please put them in the chat. And then at the end, we will address them all together at that time. Perfect. Well, I'm going to get started. My name is Elizabeth Stalder. I'm one of the nurse practitioners with the Adult Congenital Heart Center. We are so excited to have Dr. Jesse Hansen here with us today. He is going to present on the focus on exercise with congenital heart disease. Just a little bit about Dr. Jesse Hansen. He is a pediatric cardiologist at the University of Michigan. He uses exercise testing and exercise therapy to help young people with congenital heart disease live healthier lives. He leads the U of M Clinical Exercise Laboratory, where he has created programs that combine to support young patients with serious heart conditions. Dr. Hansen also works on national projects to make exercise therapy easier to access, like the Heart Club, a program that helps patients with Fontan circulation exercise at home using telemedicine. He is passionate about teaching, creating classes and conferences to help others understand how exercise can benefit young people with heart disease. Dr. Hansen's research focuses on finding new ways to improve the lives of those living with congenital heart disease by studying individualized exercise therapy plans at home and in the community. So without further ado, I'm going to let Dr. Jesse Hansen take over.
Awesome. Thank you so much for that introduction, and I really appreciate the invitation to come and talk today. You know, there's still a whole lot to learn about what is the best kind of exercise or what is the best way to do it to help impact or kind of optimize to the best extent outcomes in people who are living with congenital heart disease. But that doesn't mean that there isn't a lot that we already know and a lot that we can already do to, I think, help people get engaged, to feel better, and actually to think about thinking about exercise. And so those are some of the things that we're going to talk about today. So today is not a day where you're going to be able to get specific, exercise instructions that are applicable specifically to you and your current health status. But we're going to talk about different ways that you can think about where you are in your life and how that impacts your ability to stay active, or if you're not as active as you want to be, to become active over time. And so let's go ahead and get started. Most people in modern medicine have been told at some point that they should exercise. And unfortunately, for a lot of people, that's where the direction and the support for what they should be doing, that's where it ends. There's not really any more direction. There's not really any more structure. The motivational component of that kind of statement is not very helpful. And in the result is there's no action, right? It's hard to take that statement. You should exercise. You should be more active. You should do things that are healthy for your heart. And it's really hard to understand, like, what does that actually mean? So one of the things that I think is really useful is to first, before we jump into the topic and say, what is exercise and what are the things, what are the components of an exercise plan that are important, I think we can take a step back and we first have to understand who are we? Who am I myself? And I think you need to ask yourself these questions because these are really going to inform what successful activity plans and what healthy and lifelong activity and healthy behaviors look like. And so all of us, for every single behavior, all of us are in one of these stages, right? And we're going to walk through the stages, and I'm going to give examples of some of the different things that kind of identify people who are in that stage. and ways that you can do a little mini self-check and say, hey, yeah, this actually describes me. How do I take the next step based off of where I am today? And so this is from like a mindfulness or a mental framework standpoint. And you can do the same thing when you're thinking about like, what is my level of health and where do I get started with exercise? And we'll get to that a little bit later. So let's start with pre-contemplation, right? This goes back to you're sitting there in the doctor's office and they're telling you you need to be healthy. To be healthy, you need to be active. And many people haven't even started thinking about that. So those people would be in the pre-contemplation phase. This is not my problem. It doesn't matter. This isn't something I can't even do. Or even, what are you even talking about? Like, no. So that's that pre-contemplation phase. You're not doing the new thing. And not only are you not doing it, you're not even thinking about it. And I'm going to guess by most people that are here today probably aren't in this stage. You're probably at least thinking about it. And so this is a place that I actually spend a lot of time working with other cardiologists, is how do we help activate people who aren't even thinking about being active? They don't even comprehend that it's something that they could do, right? That's something that we work on as medical teams. So I'm going to kind of move through pre-contemplation. Just know that like if you are that person, whether it's related to exercise or something else, whether it's for me, I've been told journaling is good for my mental health, right? I am not even thinking about doing it, right? I've got other things on my mind. So I'm in the pre-contemplation phase for journaling. So we're all in this pre-contemplation phase for some type of health behavior. So it's okay to be there. Be vulnerable, be open-minded, recognize that you can change your own outcome and that there are things that you can do. Medicine is something that you can participate in, not necessarily something just happens to you. So we'll jump past pre-contemplation and now get to contemplation. My hope is that for some of the people that are watching this, like this is a phase that you're in right now. Maybe this is something that I need to deal with. I think it matters, but I'm not sure. I want to, but I'm not really sure how to get started. So that's that phase where you're not doing the new thing, but you're starting to think about it. And so what can you do when you're in this phase? Well, oops, let's see, I'm a little bit frozen here. Here we go. So the next steps for contemplation, right? So this is a really important place to maintain some of those other behaviors we talked about for pre-contemplation. Like be vulnerable, like be willing to put yourself out there and ask questions that might make you feel uncomfortable and might, get at some of those feelings of like inadequacy or maybe like I can't do this or I'm afraid to do this. In this contemplation phase, you're going to have to start approaching some of those things. So you can start just by asking a lot of questions. And being here and listening to this talk is a great place to hopefully start answering some of those. You need to be honest about your strengths and your weaknesses here. Okay, because if you just plow ahead and you say, I'm going to take this off the shelf exercise thing that my friend did that they said worked for them, and I'm going to do that for me, right? Like it's probably not going to work exactly the same way it worked for your friend. You're a different person. Even if that friend has the exact same heart condition that you might have, like there's going to be differences about your interests. What are you good at? What do you have access to? What are the things that make you stumble? What are the things what are the ways that you get in your own way? I think we have to be realistic about those things and recognize we all have strengths, we all have flaws, and accepting those things and building off of those things is really the path to getting better over time and to maybe changing, getting more strengths and maybe shoring up some of your weaknesses. But the only way you can get there is to be really honest with yourself when you're getting started. And this is something that can be really hard to do. Hopefully you feel comfortable talking about your weaknesses with somebody important in your life. And whether that's somebody that's part of your care team or somebody at home or somebody, a friend or a family member, like making a list of what are the things that I'm really good at and how are the ways that I kind of trip myself up and start making plans to route around those. So that's one of the lists. The next thing on here is make a list. So make a list about your strengths and weaknesses. Make a list about your interests and your goals, right? And then find role models and resources. So hopefully today we'll have some resources for you. But I want to now take a moment to talk about one of the role models that I've come across. So this is Megan. She lives with congenital heart disease. And she's worked with me a lot and actually has helped me give a version of this presentation before. And she talks about her turning point where she went from somebody who was not active at all and her medication list was getting longer, and she was starting to not only have her congenital heart disease, but she was starting to have things like prediabetes and high blood pressure and it was in the middle of the pandemic, and this picture popped up as a Facebook memory for her, and she really didn't like it. And it was like that was the starting point for her that really made her go from that pre-contemplation phase, I'm not even thinking about it, to like, okay, I got to take this on. What am I going to do next? Okay, so we're going to learn more about Megan a little bit later, but I want people to recognize that like the thing that pushes you over and really starts the move it doesn't have to be a big thing, right? It can be a small thing, a collection of small things. And so I'm glad that you're being proactive and being here today to hear more about this. So in that moment, Megan went from pre-contemplation to contemplation, or maybe she was already thinking about it, but then she moved from thinking to, okay, I've got to do something about this. Where am I at? And how do I get to the next step? Right. So this is the preparation phase, right? So statements that people might make when they're in this preparation phase is, I'm ready. Like I'm ready to change. I might not know everything that I need to know, but I'm ready. And I want to learn more about this. So I'm like looking at websites, I'm talking with friends, I'm talking with my doctor. Hopefully that's useful. I wouldn't be surprised if you said it wasn't that useful sometimes. I know I've had conversations with my doctors that felt kind of not super useful, and that's okay. That's okay. I'm going to give you some questions in a few slides that maybe you can take back to your doctor and help start that conversation. Because some doctors, even some cardiologists, don't really feel comfortable talking about these things sometimes. So I'm going to arm you with some questions that you can take to your team to help building you up to move from one stage to the next. So for those of you in that preparation phase, this is the phase where you're committed to doing the new thing and you're like actively doing stuff. You're getting supplies, you're like getting allies, you've found your mentor, or you found your role model, and you're making your plan. So this is a really important stage, and it might not last very long, right? But you're either going to move from the preparation phase and move into action, which we'll get to, or that kind of head of momentum, that buildup of energy that you have may fade and wane, and you might move back into contemplation, and that's okay. That's okay, but just know that when you have that moment of energy and insight or excitement or activation, whatever it is that got you there, like take advantage of that. Be proactive and reach out to people. This is a really important time to discuss with your medical team what the safe exercise limits are for your doctor. And I'm going to give you some kind of questions about that to take to your doctor later on. And this is a really important place to start where you are, right? Like if you've never gone to the gym, making your plan be like, I'm going to go to the gym every day next week. Like, no, that's going to be such a significant shift in your life. So start where you are. And this goes back to that idea of like being realistic about what are your strengths and your weaknesses. Know that the way to success is small changes that add up over the weeks and the months and the years to become huge changes over time. But each individual little step along the way wasn't actually all that different from what you were doing before. And that's really how we build. And it's that slow, persistent progression that really builds healthy habits and builds things that you can actually maintain and keep doing. We've all tried like New Year's resolution, I'm going to stop eating any food with sugar in it, right? And that might work for a week or a month or maybe even a few months. But like these big drastic changes can be really hard to stick with. Just the way that our minds work, the way that our bodies work, like we need to kind of build in slow steps. So start where you are is one of the most important things that I can talk with you about today, because if you start and you're honest with yourself, like I've never run ever in my life. Like your goal probably shouldn't be to start with a 5K or even a mile, right? Like your goal should maybe be to go on walks that push you, or even less than that. Maybe you're going to do some light activity around the house to get comfortable with moving. Maybe you got a new pair of shoes to make you feel comfortable. You're going to break those in around the house while you're doing your normal daily stuff, like little small, I call them even micro goals sometimes. And I do think having a plan is important, but make sure that that plan is realistic and that your goals for what am I going to do this week? What am I going to do this month? What am I going to do in 3 months? That those are things that are actually attainable, because checking off those goals matters. So start where you are, be realistic about your plan, and get help to make that plan from people who know your heart, and know both your physical heart, right? Like how your heart is built, but what's your emotional heart? Like what makes you glow? What makes you happy? Like those things should all be built in to your plan. Okay. So now you've done your preparation, you've got your plan, right? You're getting going. And what are the types of statements that you're saying? Now you're saying things like, I'm doing this. Like, I still need to learn more. And like, how can I sustain this? How can I maintain this? Like, I feel like I'm faking it right now. This is not me. Like, these clothes don't fit on me. I don't feel like this is something that is real to me. You're faking it until you make it. And that's totally okay. Like, lean into those feelings, know that that's fine, but as long as you keep on doing it, then you'll be good. So action is the phase where you're doing the new thing, but it's not yet a habit. So habit formation takes about 6 months, it turns out. You have to be persistent and regular in doing it, right? So let's go back to Megan. What was her action plan? Well, this was the middle of COVID. She had a whole lot of time on her hands, but couldn't really go anywhere and didn't really feel like going to gyms or places like that. But her neighborhood had this little loop, right? And along the loop, there were benches. So like every quarter mile, there was like a little viewpoint where you could stop and there was a bench. And so her goal was slowly over a summer to get from one bench to the next until she could do the entire loop. And I think if I remember correctly, the loop was something like a mile or a mile and a half. So she started from a place of doing almost nothing as far as like exercise. And she started, I'm going to walk a quarter mile. I'm going to go to that bench. I'm going to take a rest and I'm going to come back. And through that summer, she progressed. And by the end of the summer, she was able to walk the entire loop without stopping. And she had that visual check mark, right? She's like one bench to the next to the next. So there was like, I had small, simple goals that were very clear. It's like, I need to make it to the next bench. And she did it piece by piece. And so she was very successful that summer. So she had a good measure of her progress, of how her plan was going. She set reasonable goals and she was successful about it. Okay. So in your action plan, first off, like good job for even getting started. Like so many people never make it there. And the fact that you have gotten to this point where you're like doing a new thing that can be scary. You have to really sometimes you really have to dig deep and put yourself out there to do that. Maybe you're in a new environment. Maybe you're trying to go to the gym. Like that can be a really vulnerable environment for a lot of people. I talk about the gym, like you can be a super healthy, active, and exerciser and never ever set your foot in the gym ever in your life. So I use that as an example only because it's something that people think about and they know that feeling of vulnerability of being there or feeling being seen in a way that they may not feel comfortable. But good job. You're doing it. If you're in the action phase, you're doing it. Be kind to yourself, right? Expect that you're gonna have missteps, that you're gonna maybe sleep through your alarm if your goal was to wake up early, or if your goal was to work out after work, go on a walk or play with your kids or whatever, and you were just too tired and ended up not. That's okay. That's okay. There are going to be challenges. There are going to be barriers, and expecting perfection of yourself is never going to be true. Like we can never be perfect. We can never be the ideal thing that we want to be. But if you're at 80% of everything that you wanted to be, hey, like that's pretty good. 80% still a B. I think if you work out 80% of the recommended time, like you're going to be so much healthier than if you did nothing. And so, give yourself space to be human, to make mistakes, to have a lazy day, or to have a sick day. Maybe it has nothing to do with your control, right? There's going to be challenges, and that's okay. So expect these false starts, expect challenges. And again, the important take home point, having goals, both easy to goals, like what am I going to do today? What am I going to do this week? And that big long-term goal, what is my guiding North Star? Why am I doing this, right? Finding your why is really important. A lot of people that we meet when they come into Heart Club, which is our intensive exercise kind of initiation program that we have at University of Michigan, we spend a lot of time at the beginning helping them really find their why. Because then when you fall onto these challenges and you come up against a barrier and you get frustrated with yourself or maybe your partner or maybe your friends are being pushy or maybe they're not as supportive of exercise partners as you thought they were going to be, like you can remember back to the like, why am I really doing this? And it should be something that's really important and deeply matters to you. And that will pull you over these barriers and these challenges. So have that short-term goal that's easy to do, but have that long-term guiding light that is really pulling you forward through some of these difficulties. All right. So you've started doing the new thing. You've made some mistakes. You've stumbled. Maybe you got sick. Maybe you had a week in the hospital and it took you 2 weeks after that to get back into it. But like you've done the thing and you've been persistent. You've been kind to yourself. And now you're like starting to feel like, hey, like I am an active person. Like I don't feel so weird putting on my workout clothes. I don't feel so weird doing yoga, putting my body in these funny shapes, right? I've found new things that I like to do. What other things? What other new things that maybe were scary or felt inapproachable before I started? Like my options are only getting broader now that I've started doing and I've persisted doing and I've been kind to myself and I'm trying to ask questions. So those are the types of behaviors and the types of thought processes that are going to get you from preparation through action and hopefully into the maintenance phase. And now in the maintenance phase, so you're thinking about like, what are the other stuff that I like to do? How can I bring that in? Who are the people that I like to be with? Can I figure out how to be active with them? Um, those are the types of things. And you're thinking forward, right? Like you've in the action phase, you've stumbled and you've tripped over things and you've had problems. And now in the maintenance phase, like, hey, when I travel for work or when it's really busy time at school, like those are difficult parts for me. When my partner is busy or stressful times with boyfriends or girlfriends, right? Those are some identifiable things that when you're going through that stuff, that it's going to be harder to exercise. And so somebody who's in the maintenance phase, instead of just picking themselves up after they tripped or after they ran into that barrier, they're really looking forward and saying, hey, I see this thing coming. What are the techniques? What are the plans that I'm going to put into place so that I can just dodge that barrier and that thing that used to seem like an insurmountable mountain, I can just step right over that now, right? Or I can navigate around it. And not all of your barriers are going to be preventable. Our bodies sometimes don't do the things we want them to do, nor do our brains, and that's okay. But those are some of the ideas and thought processes of somebody who's in the maintenance phase. So if you're in the maintenance phase, congratulations, you're still doing it. That's amazing. You should still celebrate. I think we should celebrate the good things that we're doing much more regularly than we do. We beat ourselves up for the things that we don't do great, and we never think about all the stuff that we actually do a really good job at. And that's why your friends like you. That's why hopefully your family likes you too, right? Is because you do a lot of things really well. So be kind to yourself and be like, hey, we're doing it, right? Continue to make goals because you're going to start checking off goals. You need to make new ones. You need to make new short-term goals and those middle-term goals, like in the maintenance phase, you're starting to get some of those bigger goals done, right? Maybe your goal when you started was just 3 days in 1 week. I want to do something that is good for my body. I want to take 20 minutes 3 times in the next week. That could be your kind of first goal. And now in your maintenance phase, maybe you're thinking, hey, like I've been doing 20 minutes 4 times a week. Like, what about 45 minutes? Add that in a couple times on the weekend. How can I change what I do on my weekends to take advantage of a little bit more time in my schedule? So those are the types of things that you can start thinking about in the maintenance phase. But still, we're still going to have setbacks. We're still going to have challenges, still going to have barriers. Some of those things you're going to be able to predict, some of them they're not. But hopefully you're starting to build some of what we call resilience, or that ability to come back from stumbling. And whether, again, it's yourself doing a little bit of self-sabotage, we all do it, right? Or if you got tripped by life and it had nothing to do with you and you were doing everything great, but some bad luck or something bad happened to you, like that's okay. The skills that you use to become an active person and to build those healthy habits in the face of adversity, those skills are really useful for other things like dealing with frustration with loved ones or partners or roommates, or dealing with some of the hard luck that life throws at us sometimes. And so you're going to build some tools as you move through this cycle, and those tools are going to be very useful and powerful in other parts of your life too. So my hope is by the time you're in maintenance, and even when you're in action phase, you're like finding strength and you're finding capability that you didn't even know that you had, but I promise is inside all of you. Okay? So like let's go back to Megan. Okay, so July 2018 was when this picture was taken. It was the middle of the pandemic, so sometime in 2020 when she got that Facebook memory. And then this was her in September 2021. So she was off some of her medicines. She didn't have blood sugar issues. Her blood pressure was down. She was feeling better. She had more energy. She was getting a new job because her mindset on like what was possible in her life was just totally different. And she had moved beyond, she still walked on that loop in her neighborhood, but she was doing other stuff. She was got her stationary bike. She was starting to do like fitness classes. And so it changed everything for her. And that doesn't necessarily have to be your story, but I want you guys to see that that's a possibility. And that even if your end goal isn't as life-changing as Megan's, like there's still really important things that you'll learn. And also know this cycle's not a one-way direction, right? Like you can be in the maintenance phase and you can come across a stumbling block so big. I had a big problem that landed me in the hospital for 2 months, right? Like you are no longer in your action or preparation phase, and you're either back to contemplation, or maybe your health status has changed so much you're not even thinking about being active anymore. And that's okay. Life comes at you, and you have to do the most important thing that's in front of you in that moment. But hopefully you'll get back into a spot where you already have built the tools. You've done this once, you've gone through this cycle, and hopefully you can flip that arrow back around. And doing it the second time, knowing that I've done this before, I know what I need to do. It gets easier because you've done it before. And so that first time, taking those first steps, I think jumping from like contemplation to preparation is like so hard the first time you do it. And so for all of those who are thinking about it, keep it up. I know that this is hard work. Okay, so we're on to hopefully what's going to be the most important. So find yourself in that cycle Hopefully you recognize yourself in one of those areas, or maybe bouncing back and forth. Maybe you've moved from contemplation to preparation to contemplation to preparation to action to preparation to action to contemplate, right? Like you probably bounced around a little bit, and that's totally fine. Where are you now? And start where you are. Okay. So here are some questions that you can ask when you're just getting started, right? So these are, we started, those early phases, ask questions, make a list, get resources. All right, start asking these types of questions. And first, you can ask them of yourself, but these questions are very easy to switch up and ask of people that you really care about their opinion. All right, so best friends, partners, medical team, those people who know you and understand how you work. These questions they can help you with too. So first one, do I have any symptoms when I do activity right now? Okay, that's important to make a list of those things. All right, they might worry you. You're aware of them if you're having these symptoms, right? Write down a list of the things that you feel. And some of those things, hopefully most of those things, are actually normal feelings with exercise. Or do some of these things actually represent things your heart team needs to work with before it's safe for you to really get involved in regular activity? Okay. So start by making a list of how do I feel when I do heavy chores or if I've gone on a walk, and not like the leisurely walk on the beach, which is nice and everybody should do that. But like, I'm going to go outside, I'm going to go for a walk to help my lungs and my heart and my muscles be healthier, right? I'm going to walk with a little bit of a different pace. How do you feel? Write those things down and ask yourself, like, is this normal? Is this not? If you can't answer those questions, that's totally fine. This is something, if you came in with a list of things that you felt when you first tried to do physical activity or exercise, I would be thrilled if I was your cardiologist. Some cardiologists might be scared. I would be very happy because I know that this is a hard exercise to do. Okay. Another question, what's keeping me from being active now? So again, this is looking internal. If you don't really recognize your barriers, then it's going to be really hard to make a successful plan. And so what I tell you here is be honest, but don't be mean to yourself. It's very easy to beat yourself up about things that have gotten in your way in the past, right? Some of those are self-inflicted and some of those come from other people. Or not even other people, just life, right? So be honest with yourself. And if your answer is, I don't have the time, that's fine, write that down. But there's a deeper answer, right? We all have spent time in our day to day in ways that was probably not productive. And when we were doing it, we knew that. We all do that. So, yes, you are busy and you might not have time right now, but there are deeper barriers if you're really being honest with yourself. And then when you start getting down to the things like some of the stuff we were talking about earlier, like I'm afraid of dying when I exercise. I'm afraid of people making fun of me. I remember that one time in 5th grade where my gym teacher made me run until I thought I was going to die and I threw up, and I never will ever do that again. Right? Like some of these things are really hard to, some of them are really hard to think about. But if you don't go through that process, you might be successful in the short term, but eventually you're going to have to really understand, like, what are the things deep inside me that keep me from feeling like I can make my body do these things? We're going to have to get to those eventually, and you don't have to necessarily get to all of them, but try and get past those early, easy, superficial, I don't have time for this. I'm too busy. Right? Yes, everybody's busy. But when you really find that North Star, you find that why, it turns out that maybe some of those things that were getting in the way as far as scheduling become a lot less important. And once you've been in that action phase for 3 or 4 or 5 or 6 weeks, and you start feeling your body changing and your energy levels get better and your breathing gets easier, or your confidence on the things that you are able to make your body do starts increasing, like that is going to motivate you on its own to start readjusting your schedule so that you can be more regular with your activity. Okay. So what are my goals? I've talked a lot about goals. Again, mini goals, days to weeks, and then some long-term goals, months to years. I like months more. It's hard to really goal set for years. You have to be really persistent and be able to do delayed gratification, which I know is hard for me. So I like monthly goals. Those are good, or maybe 6-month goals. And then what do I like to do? And this is, I think, a part where a lot of people get tripped up because they look at social media, they look at TikTok and say, well, what are the people who look fit and healthy? What are they doing? Then I have to do that to be fit and healthy. And that is a huge stumbling block because you probably don't like a lot of the things that they do. And in fact, having that person, those fitness influencers as your goal or your role model, that might actually pull you in a direction that makes you think things about your body or that makes you think things about yourself that might not be true and may not be helpful. All right. So think about what are the things that you like to do? And is there any way we can turn that into an activity? Like, I want you to think really broadly. You don't have to go to the gym. You don't have to ever see a treadmill a day in your life. You don't have to ride a bike. You just have to find things that make you breathe harder a little bit and maybe a little bit sweaty. And if you start with those things and you like doing them, maybe it's gardening, right? Maybe it's going on an adventure. I had one participant in Heart Club who loved archery. And so we moved where her targets were on her property so that she had to walk up some hills. And that was the start, right? We went past that, but that's where we started. So find the things that you like to do. And then how can I adjust the way that I do them so so that I get to that point where, oh yeah, I feel like I'm breathing a little bit harder. I'm not out of breath, but I can feel my breathing is getting faster. I can still have a conversation. I can still talk with somebody, but I feel like I'm working. Those things all count, and they may look nothing like the exercise that you've been told about before. So how do we do this at University of Michigan? Well, if you're in Heart Club, we do some, we look at all of your heart records, all of the fancy tests that we've had. We maybe do an exercise test if you haven't had one recently. We talk with your cardiologist about all of these different things so that we understand your heart, and then we put together a plan. And this is the very basics of what that plan looks like. Okay. So, I'm sorry if this is hard to see, but we talk about intensity, like how hard are you working, right? And that's something that a lot of people kind of get tripped up with when they're getting started, is that there's this idea that if I'm not out there totally out of breath, sweating bullets, like feeling like I just want to fall over, then it's not working, right? That's not true at all. It actually turns out that if you do middle of the road moderate exercise, for most people, even people that have congenital heart disease or heart conditions that they've gotten later in life, for most people, moderate exercise is okay. We'll need to have you check with your doctor to make sure that that's true for you, but for most, that's still fine. And what does that mean? That means that you're doing something active, right? You can feel your breathing up, but you can still have a conversation. And if you are getting to the point where you have to stop between every few words to breathe, you're in the high intensity zone. And that might not be bad for you. That might just be fine, actually. But you don't necessarily have to go there. And you absolutely don't have to start there to start getting the benefits of physical activity. And I think that that's a misconception that a lot of people have from either playing sports when they were a kid or trying to play sports, or like that gym teacher that everybody remembers from elementary school that kind of wrecked their day. Okay. So we have an intensity goal. We talk about how many days per week. And this is an intense program that we do here. We want people to be doing something 6 days per week. Now, again, that doesn't mean you're going to the gym 6 days a week, but it means 6 days a week you are purposefully setting aside time in your day to do things that are good for your body. And maybe that means you're doing some meditation and you're sitting quietly because you're on a low energy day or you're sick or you're in the hospital. and you can't do those things. You can't do the active things that you like to do right now. And so you have some meditation or some light stretching, right? Those are things that you can do even when you're not feeling well, that really protect that time. All right. So most of the days of the week, you should be doing something that you're purposefully doing because it takes care of my body. Okay. And we tell them that they should do a collection of many different things, or not many, but a few at least different things. And in Michigan, that usually means you need to have some summer stuff and you need to have some winter stuff. And so we talk about aerobics, or the things that train your heart and your lungs. We talk about strength, the thing that trains your muscles and your nerves. And then flexibility, balance, and coordination. And those are the things that maintain your mobility as you get older. Okay. And so I'm turning 40 this year, and I'm realizing that the mobility part and that flexibility and being able to maintain your balance is actually so much more important than like what my muscles look like, that all I cared about when I was a teenager. I just like wanted to have big muscles and like be a weightlifter, right? And that's fine if that's the thing that you want to do. But also know that there's other important things that we have to train. You have to train your flexibility. You have to train your balance. And that as you get older, that those things are going to be the important things that keep you active, keep you being able to go out and do things with your friends and your family. And if you have children or partners or loved ones that you want to go and do adventures with. And by adventures, I might mean like going on vacation somewhere to be able to go and walk on the beach, and be able to keep up. So think about those different zones, or these different modalities, we call them, or different kinds of exercises, and how can you find things that you like to do that fit into each of these. All right, so I talked about a few questions that people who are just getting started, so people who are in that kind of contemplation or preparation phase. How about for people who are in the action phase, right? What do you do there? All right, so here are some important questions for those people, right? How does my intensity feel while being effort? Pardon me. How does my intensity or my effort feel while being active? And like I was just talking about, if you go too hard, it might make you feel not good at the end of exercise. And too light, it's not bad. It just means that you have to do more of it. And I know we already talked about most people are busy, right? So if you're doing light physical activity, it's still good for you. It's better than nothing, but you just have to do more of it to get the benefits for your heart and your lungs and your blood vessels. Okay. So thinking about that intensity, that effort level, and how can I be middle of the road? How can I still hold a conversation while I'm being active? And again, some of you may be interested in going a lot harder than that, and that's fine too. Okay. Am I doing a variety of different activities? Keep it interesting for your brain, but also for your body. Like if you do the same workout or the same activity every single day, at the beginning, your body is going to respond to that quickly and change the way that it's built, change the way that the nerves and the muscles work together to make you more efficient at that. Okay. But if you just do the same thing every single day, those changes will really kind of tail off, and you'll still be doing healthy stuff, and that's great. But if you want to continue to progress, you got to change it up and show your body different kinds of good, healthy stress so that it can continue to grow stronger. Question 3, am I making progress? Have I hit one of these plateaus, right? Am I still making mini goals? Checking those goals off feels really good. I love checking things off of my to-do list. So make progress. And maybe your progress has nothing to do with how far you're walking or how fast you're running or how much weight you can pick up or how many crunches or whatever, right? Like maybe it has nothing to do with that type of kind of performance goal. And maybe your progress has everything to do with um, I feel more engaged with my family. I am more able to go and do a day at work and not just feel wiped at the end of the day. I feel more capable on taking on new challenges. Like that is important progress too. And reflecting on that stuff can help you still recognize progress, even if maybe, the how far you can walk or how fast you can walk, maybe that's not changing as fast, and that's okay. All right, keep it up. And then this kind of ties back into a lot of the things that we've talked about. Like, what am I learning about myself? You're going to learn stuff about what you like, what you absolutely don't like, the things that trip you up, the things that make you successful. You're going to learn about those things along this journey of becoming active, and remembering those things and recognizing that those lessons are, first off, hard earned, so good job. And secondly, those lessons nobody can take from you. So even if you have a stumble, even if you get sick, even if you have a setback, you still have learned things about yourself that are going to make you more powerful, more capable, and more able to kind of bounce back from those difficulties that life throws at us. Okay, so I just wanted to show an example of the different types of themes that we talk about in Heart Club. So Heart Club is a 6-month program that we have at the University of Michigan, where we help walk people through a lot of the things that I've talked with today. And right now is currently for people who have a specific kind of congenital heart disease and they've needed a Fontan palliation. But we're hopefully going to be expanding that in the future. So these are the stage themes here. And then we kind of talk about the exercise curriculum. So what are the different types of exercise and activity that we introduce to people? And maybe you feel like you're a beginner, or maybe you actually have a little experience and you're here to understand what are the next steps that I can take. So look at some of these ideas and some of these themes in curriculum, and these are things that you can ask your medical team about as well. And maybe they don't know the answers to what can I do for resistance training. But my hope, and what some stuff that we're working on in other areas, is to provide cardiologists with resources so they can answer these questions. So I'm giving you the questions, and my hope is that we can help give your cardiologist some of the answers. But asking these questions and trying to find resources to help you move through these different stages may be useful for you. And then lastly, we have some resources for here for your patients, and then here for your cardiologist. And so the talk test I've kind of talked about a couple of times, but I haven't named it. So the talk test is that ability to be able to talk and have a conversation with somebody, but maybe you're breathing hard enough that you can't sing, right? So that's that. My breathing is up, I'm breathing a little bit harder, but I'm not out of breath. So that's that moderate level for the talk test. And then these are some podcasts that Megan really likes and that she used as part motivation and part distraction for when she was doing her walks. And then she also liked accountability groups, where they would go and talk about what are the active things, what are the healthy things I've done for myself today, so that you feel responsible to like show up for somebody else, even if you maybe don't have the energy to show up for yourself that day. And then some things that your cardiologist can look into if they are not quite sure. So with that, thank you for listening, and I'm happy to take any questions that people may have.
So it looks like we do have a couple questions that came in. Why don't we start with this one? How can I help my PE teachers and coaches support my safe participation in physical activities? And what are my personal limits for sports and exercise?
So yeah, kind of two questions in there. What are my safe limits, and how can I help my, whether it's PE or gym or coach, or a workout partner? Maybe you're doing this with a friend. How can I help them understand? And so part of that is really understanding or knowing what are the specific things, if you are somebody who's living with heart disease, what are the specific things about your heart that are important to know about? And your cardiologist should be able to help you with that. What are the parts about my unique heart history that are going to kind of set some of those guardrails? And so that's not something that we can give you today per se, but it is something that you should be able to work with your team for. And then how do you communicate that? Well, if you're in with for people in the community, so like coaches or gym teachers. So if you're in a school environment, so say you're a high school or in college, a lot of times they have set letters or forms that need to be filled out for medical clearance. And usually your heart team can help with that. And some of the other things that we're doing in kind of spreading tools for this for cardiologists is we're trying to give example templates that they may be able to use to help write these letters. If you're a parent of somebody with congenital heart disease, then and you've had problems with that, there are legal opportunities to kind of force school districts and schools to provide accommodations to make sure that your family member can still participate in the gym class that they need. And so there are several different ways that you can go about that. But so the short answer for that is first talk with your team, your heart team, to really understand what your personal limits are, and then be open and thoughtful with the people that matter to you and find the right team, right? Like if you're with a coach that won't work with you, find a different coach. Um, and if your school won't work with you, I know you can't find a different school, but a lot of times there are legal avenues like a 504 IEP that you can include gym class into.
Awesome. We have this question. How should I check my heart health before exercising? And how can I use this information to stay active safely?
Yep. So taking some of those questions about your goals, your interests, and your barriers, and talking with your heart team about those things can really inform, what are the important parts about your heart. If I'm talking with somebody who was born with congenital heart disease and they want to be a competitive cross-country runner for their school, that's a very different conversation than somebody whose goal is to be able to walk from the hotel that their family likes to stay at all the way down to the place that they like to picnic on the beach, right? So like whatever your goals are really going to inform what your heart team needs to know about your heart to check your heart health. And then there's things that you can do on your own as well. Like, how do I feel today compared to, you know, last week or last month? When you're doing more regular activity, like you should feel stronger and better generally over time. Like we all have lower days or days where we're sick, but generally the trend should be that you feel like you're able to do more. And if you feel like you're doing less and less over time, even though you're trying, that's an important kind of flag to talk about with your heart team. And then there's other things like if you're having, feeling like you're going to pass out or having a lot of pain in your chest or you're having a lot of, weakness or fatigue that's lasting for days after you try physical activity, then that's something that you should probably talk with your medical team about. Um, so kind of broad answers to that question because it's hard to have details, but knowing your own kind of trajectory and then also knowing what your goals are so that can inform the important parts about what are the important parts of your heart health.
And then this one just came in. Any advice for parents of a young child with congenital heart disease to help them understand the importance of staying active?
Yeah. Oh man, this I totally understand. I'm a parent of young children, and you so dearly want them to, um, you lead them to water. You can't make them drink. You give them healthy food, and all they want is crackers. Like I totally understand that. I would say one of the things that I've found really successful for young kids, and I'm thinking kind of grade school, um, is first off modeling, right? Like if they see you doing healthy, active things, then that's going to be the normal expectation that that's just what you do as part of your everyday life. And that may not be possible for everybody, but that is an important thing. And I feel like a lot of times families get healthy together. And so consider what going on walks as a family, putting them in the stroller, um, making it fun. And that's the other thing is as adults, we think about exercise as like, I'm going to take 30 minutes. I'm going to get on my treadmill. I'm going to run for 30 minutes or walk, and I'm not going to feel great. And I'm going to be kind of bored, but I'm going to do it because I know it's good for my body. That works in an adult brain mindset sometimes. but that's just not how kid brains work, right? Like that's just going to be torture for them. And so how can you find ways to play? So things like treasure hunts, or one of the things we like to do in our neighborhood is we have sidewalk chalk, and we'll do little maps around the sidewalk where we have them hop and jump, and you follow the arrows and you have to find the next one. So how can you turn active, activities where you're moving your body, turn them into to play, turn them into games, and then it's kind of like hiding vegetables in a casserole, right? You can hide the exercise vegetables in a play casserole, and then they accidentally have fun with you, and they accidentally are being physically active. So those are things that you can do. I know that's not easy for all families. Not everybody has a safe place to go outside and play. And so sometimes you have to be creative, but the floor is lava. You can do all kinds of obstacle courses inside your house, where you're, moving from one place to another and having a good time. So try and think creatively. And the Fontan Outcomes Network is a group that has just published a healthy activity, or let's see, it's healthy lifestyles, or I can't, I'm blanking on the name right now. It's a toolkit for young patients who are living with congenital heart disease. A lot of the language in there is for people specifically with Fontan circulation, but the tools in there of like, how do you play with your kids in a developmentally appropriate way? Those are open and accessible to everybody. And so that absolutely is a resource. So that's Fontan Outcomes Network, the Toolkit for Active Living. That's the name of the thing that we built. And I think that there's a lot of good information in there, especially for people with young families. That same group is going to publish something for adolescents and young adults here, hopefully over the next 6 months.
Awesome. We have this one. Which activities are best for me, and how can I tell if an activity is safe or if I'm overdoing it?
The activity that's best for you is the thing that you like to do, that gets your body moving, that makes you breathe a little bit, and maybe makes you sweat a little bit, but doesn't make you feel bad, and that you feel better when you're done doing it. So again, I think we have a very narrow frame is given to us in our community, in our society, about what it means to be physically active, and what exercise is. It can be anything that gets your body moving. And if you like it, that's where you start. And how do you know if you've overdone it? Exercise isn't always easy. Physical activity isn't always easy. But when you're done with it later that day, you should feel energized. And maybe you feel a little bit tired. Maybe you've got some soreness. If you tried a new thing, your muscles will be sore for a few days, and that's okay. But overall, you should feel energized and happy about the things that you're doing. And you should feel like you're getting stronger. And if those things aren't happening, you can talk with your team about what might be some of the roadblocks that you haven't identified yet.
And then I'm going to do just two more left, then we're going to wrap it up because I know we've used a lot of your time here, Dr. Hansen. But this question, what should I be feeling during exercise, and how can I differentiate between normal and concerning sensations?
Yep. Yeah, that's a really hard question for a lot of people who are just getting started, who maybe have never exercised because for whatever reason, right? And so getting used to that feeling of breathing faster and having your heart beating faster and harder. For a lot of people, especially people born with congenital heart disease, like those have been ways that they felt when they were really sick. And so they can be scary feelings. But if you are actually in an okay state of health, and you have talked with your cardiologist about starting an activity program, getting used to having those feelings of like, I'm breathing harder, my heart is beating harder. But when I stop doing my activity, within a few minutes, those things all get back down to normal and I feel okay. Like learning to be okay with that feeling and to know that that's a normal feeling is an important part. That's part of that kind of preparation, action, part of the behavioral change loop. And that's something that we can't necessarily give you. One of the things that I like to do in the exercise lab, so where we kind of have people with heart conditions come and ride a bike or get on a treadmill, is we can monitor them in a situation and they can have those feelings, and we can check and say, hey, we don't see anything going on. Like your numbers look really good. All of your other tests look good. Like this is what normal exercise feels like. Those types of opportunities can absolutely be available if your cardiology team has an exercise lab, or that's one of the benefits that you can get from a stress test, which is a totally other topic that we can talk about another day. But one of those things that you can learn is, what does it feel like to exercise and have that normal fast heartbeat? Things that you should talk to your doctor about, especially, or maybe even kind of get help if they're happening. If you pass out during exercise, that's a really important sign that we might need to just double check and make sure something hasn't changed about your heart health. There are non-serious reasons to pass out after exercise, but that needs to be something that you work through with your doctor if that happens. Similarly, like chest pain, there can be a lot of non-serious reasons to have chest pain that are actually okay, but you should talk with your doctor about those things. Having racing heart or fast breathing that doesn't get better once you've stopped, that's something that you should absolutely talk to your doctor about as well.
And then last question, are there community resources or therapists that can help me with adaptive sports or improving my physical activity?
Absolutely. So adaptive sports is a term we haven't really talked about a bunch today. That's basically people who specialize in making sports more accessible for people whose bodies work differently. And like the classic example of that would be something like wheelchair basketball or a sit ski, where people are able to do a sport that they want to do, even though maybe their legs work differently, or maybe their eyesight is different, and so they need an adaptive sports specialist. So those things absolutely exist. So if you're somebody living with a heart condition that's had a stroke, or you've got nerve damage or muscle weakness on one side or the other, those adaptive sports programs can actually possibly be a benefit to you. The other team of experts that I would strongly recommend is working with physical therapists. And most heart centers have a physical therapy team that they can work with and get you on track to make sure that we can get your body. So I think of physical therapists as experts who can take you and get you ready to do exercise on your own. If you've got limb or joint or muscle issues that need, specific attention or specific types of very specific exercises to get you ready to do more regular active play stuff.
Well, wonderful. Thank you so much, Dr. Hansen. It was wonderful having you on. I want to thank all the people who attended with us today. As a reminder, this was recorded and will be posted on our ACHD website if you want to send to other people or review it later yourself. And we have another webinar coming up on October 22nd with Dr. Angela Quain titled Women's Health and Congenital Heart Disease, for anyone who would like to check in with us in October. Thank you all so much.
Thank you.